And as Hoosiers deal with grief and loss from this past year, the Behavioral Health Department at Community Health Network is seeing an increase in suicidal attempts and people dealing with anxiety. Our Nicole Griffin shares important takeaways for those who have been isolated this past year and may be in a dark space.
People are struggling. People are having a hard time.
Vanessa Enos knows the feeling of loss that the COVID-19 pandemic has brought to so many.
We've lost 500,000 people or more. I'm one of those people. I lost my grandmother at the beginning of this.
She's the program manager at Community Fairbanks Behavioral Health, where they not only support community members, but also the nurses and doctors within Community Health Network on the front lines.
I think there will be some PTSD from just that constant exposure to death and unpredictability and heartache.
Enos says isolation has been a huge factor for many during the pandemic.
I haven't seen my kids since Christmas.
David Jones had COVID-19 almost a year ago.
I've also been dealing with MS. My T-shirt says, "God only gives us what we can handle." And apparently God thinks I'm a superhero.
He says what's kept him lifted during the pandemic is being able to connect with friends and family through technology.
No matter how bad things get, there are others that have it worse. I mean, because I'm going through the COVID thing, I'm going through the isolation thing, but, I've got family and friends available, and not everyone has that.
According to the Behavioral Health Department at Community Health Network, within the last year, there has been a 300% increase in the call volume to the National Suicide Prevention Lifeline. Enos says it's important during this time to connect with your loved ones.
Reach out safely to whomever you have as a support in your life, whether that's a phone call, a text message, connect.
Working for you, Nicole Griffin, WRTV.